We looked at the mechanism of action of antiviral agents used for treatment of hepatitis C. We evaluated drug-drug interactions and designed individualized monitoring plan for patients. We also provided patient education for adverse effects. Now, the last learning objective is recommend lifestyle modifications to a patient with hepatitis. One of the most important educations to provide to the patient is that they cannot have immunity to hep C infection even though they've had the infection before. So there will always be risk factors for reinfection. So someone who already was treated, they can get reinfected if they continue the risky behaviors that they have. So injection drug use and intranasal illicit drug use are one of the most common risk factors for getting hepatitis C. And by avoiding these risk factors, reinfection of hepatitis C can be prevented. Another education that we should provide to the patient is that because hepatitis puts them at risk of getting cirrhosis and also progression of cirrhosis or other liver diseases, it's important to avoid any risk factors that can actually accelerate progression of liver disease, such as alcohol consumption. Now, statins have actually been shown to be able to reduce the risk of cirrhosis development. Now, while it's not, we're not going to recommend statins in patients with hepatitis, if they have other indications for statins, so let's say ischemic heart disease, it's very important to make sure that these patients are getting their statins because there's the added benefit of reducing the risk of progression or even development of cirrhosis. So hepatitis alone is not an indication for studying statins, but if the patient is on statins, it will definitely help. So here are some counseling points for the patients. So these are the things that we can tell patients in order to prevent hepatitis C transmission. So it's important to let them know that they should avoid sharing toothbrushes, dental shaving equipment. They should not donate blood while they have hepatitis C infection. And they should avoid illicit drugs. Now, in general, risk of sexual transmission is low, except in patients who actually have sexually transmitted infections or HIV, as well as patients with multiple partners. We can also educate the patient on ways to reduce progression of liver disease. So if the patient has multiple infections that can affect the liver, it will actually accelerate fibrosis. So hepatitis B and HIV can also affect the liver, so they cause inflammation in the liver. So it's important to test for those conditions and receive treatment. It's important for the patient to be evaluated for advanced fibrosis, as well as to update their vaccination, especially for hepatitis A and hepatitis B vaccines. And of course, it's important to emphasize the importance of avoiding alcohol to the patients. Other important things to discuss with the patient include discussing the importance of smoking cessation if the patient is smoking, because it has actually been shown that while curing hep C is fundamental, not smoking or smoking cessation can actually improve survival in this group. And lastly, one thing that we continue to get more and more data on is the benefit of coffee. Specifically patients who received at least 3 cups of coffee per day compared to people who drank less than 3 cups per day. And this is specifically in patients who had co-infection of HIV and hepatitis C. The risk of mortality was actually reduced by half. So you can see here on the horizontal axis, we're looking time, and on the vertical axis, we're looking at the risk of mortality, at the one being 100% risk. And as time went on, and this is an ongoing cohort study in France, is that at year 5, the risk of mortality was reduced by half in patients who received at least 3 cups of coffee. This concludes this presentation.